Ever pondered about the magic that puts you to sleep before a surgery? What exactly are these mystical substances we breathe in that whisk us away into unconsciousness? Today, we're going to uncover the secrets behind this enchanting world, the realm of inhaled anesthetics. These are not just simple gases or vapors. Instead, they are complex substances, carefully engineered to safely plunge you into a state of unawareness, allowing surgeons to perform their miracle work. These anesthetics have been instrumental in advancing medical procedures, transforming what was once unthinkable into everyday miracles. They have changed the face of medicine, making surgeries more humane and less daunting. But what are they? How do they work? And why are they so important? These are just a few of the questions we'll be exploring, so buckle up for a journey into the heart of medical science. Stay with us as we dive deep into the fascinating world of inhaled anesthetics. To start, it's crucial to understand what anesthesia is and why it's so important. Anesthesia, derived from the Greek words meaning without sensation, is a state of controlled temporary loss of sensation or awareness. It's a medical intervention that allows patients to undergo surgery and other procedures without the distress and pain they would otherwise experience. Anesthesia can be broken down into three main types: local, regional, and general. Dive into local anesthesia first. Imagine you're at the dentist's office for a simple procedure. The dentist applies a numbing agent to a specific area of your mouth. You're awake, you're aware, but you don't feel any pain in that area. That's local anesthesia in action. It numbs a small, specific area of the body. On the other hand, regional anesthesia numbs a larger area of the body, often used for procedures on the arms, legs, abdomen, or even childbirth. It's given via an injection near a cluster of nerves and can be combined with sedatives to help patients relax. Now let's talk about the big one, general anesthesia. This is the type of anesthesia most people think of when they hear the word. It's used for major surgeries and involves medication that puts you in a deep sleep or a state of controlled unconsciousness. You're not aware of what's happening and you don't feel pain during the procedure. These types of anesthesia play a crucial role in surgery. They allow surgeons to perform procedures that would otherwise cause intolerable pain, and they let patients undergo these procedures without the distress and discomfort associated with feeling the surgeon's every move. In essence, anesthesia makes it possible for patients to tolerate both minor and major surgical procedures, ensuring they don't have to experience the pain and discomfort that would come with being fully conscious and sensitive to pain. Remember, while anesthesia is a routine part of many procedures, it's not simple. It requires a skilled healthcare professional, known as an anesthesiologist, to administer and monitor its effects. Now that we know about anesthesia in general, let's focus on the inhaled type. So, what are inhaled anesthetics and how do they work their magic? Inhaled anesthetics are a group of pharmacological agents that have been used since the mid-19th century to induce a reversible state of unconsciousness. This state, commonly known as general anesthesia, is achieved by inhaling the anesthetic agent through a mask or breathing apparatus. These agents work by reducing the sensitivity of your nervous system, making you unconscious and unresponsive to pain. The discovery of inhaled anesthetics marks a significant milestone in the field of medicine. Before their discovery, surgery was a dreadfully painful and dangerous process. The first successful use of an inhaled anesthetic, ether, took place in the year 1846 during a surgical procedure performed by William T.G. Morton. This event, known as the Ether Day, transformed the world of surgery. It made procedures safer, less painful, and allowed surgeons to perform more complex operations. Inhaled anesthetics work their magic by inducing a state of general anesthesia. They accomplish this by interacting with certain receptors in the brain, thereby reducing the activity of the central nervous system. This leads to a decrease in the perception of pain, loss of consciousness, and muscle relaxation. But it's not just about knocking you out. The anesthetist can control the depth of anesthesia by adjusting the concentration of the anesthetic agent. This ensures that you stay asleep during the procedure but wake up when it's over. However, it's important to note that inhaled anesthetics don't work alone. They are usually used in combination with other medications, such as intravenous anesthetics, to achieve the desired effect. These combinations are carefully chosen by your anesthetist to ensure your safety and comfort during the procedure. Understanding the types of inhaled anesthetics will provide a clearer picture. And that's what we're going to dive into next. So hold on to your seats as we delve deeper into the world of inhaled anesthetics. Inhaled anesthetics come in many forms. each with its unique characteristics. Let's take a closer look at some of these fascinating compounds. First up, we have nitrous oxide, often referred to as laughing gas. It's a colorless, sweet-smelling gas that's been used in anesthesia for over 100 years. Nitrous oxide is not potent enough to produce general anesthesia on its own, but it's an excellent analgesic and is often combined with other anesthetics. Next in line is halothane. Introduced in the 1950s, halothane was the first inhalational anesthetic that wasn't flammable, a big safety improvement over its predecessors. It's potent and has a rapid onset of action. However, it's rarely used today due to its potential to cause liver damage. Moving on, let's talk about sevoflurane. This one is a modern favorite, widely used due to its rapid onset and smooth recovery. It's also less irritating to the airways than some other agents, making it a good choice for patients with respiratory issues. Desflurane and isoflurane are two more commonly used inhaled anesthetics. Desflurane is praised for its quick recovery times, while isoflurane has a track record for being stable and reliable, although it might cause a slower wake-up. And then there's xenon. It's a newcomer to the field, being non-toxic, non-flammable, and quick to act. But its high cost and limited availability have prevented it from becoming more widely used. Each of these inhaled anesthetics has its own unique set of properties, including their potency, speed of onset and recovery, and side effects. These characteristics, along with the patient's specific medical condition, guide anesthesiologists in choosing the most appropriate one for each procedure. Though they might seem different, all inhaled anesthetics share a common mechanism of action. They reduce the activity of the central nervous system, leading to a state of controlled unconsciousness, or what we commonly refer to as anesthesia. Ever wondered how these inhaled anesthetics work on a molecular level? Let's dive into the fascinating world of their mechanism of action. Inhaled anesthetics are small, fat-soluble molecules. They are capable of crossing the blood-brain barrier and reaching the central nervous system. Once there, these anesthetics interact with various proteins in the nerve cells. Most commonly, they bind to a class of proteins known as ion channels, which are essentially gatekeepers of the nerve cell. These ion channels control the flow of charged particles, or ions, in and out of the cell. This flow of ions is what generates the electrical signals our nervous system uses to communicate. Now, here's where things get interesting. Inhaled anesthetics primarily act on two types of ion channels. They enhance the activity of inhibitory channels, which tends to slow down nerve activity. At the same time, they inhibit the activity of excitatory channels, further decreasing nerve activity. For instance, anesthetics like isoflurane, sevoflurane, and desflurane primarily act on a type of inhibitory channel called the GABA receptor. By enhancing the activity of these receptors, these anesthetics increase the inhibitory signals in the brain, leading to a state of general anesthesia. On the other hand, anesthetics like nitrous oxide work a bit differently. They inhibit a type of excitatory channel called the NMDA receptor. By decreasing the activity of these receptors, nitrous oxide can reduce the excitatory signals in the brain, contributing to its anesthetic effect. In this way, by subtly altering the balance of inhibitory and excitatory signals, inhaled anesthetics can induce a reversible state of unconsciousness, pain relief, and muscle relaxation. This is why they play such a crucial role in surgeries and certain medical procedures. It's fascinating, isn't it? How these tiny molecules can have such a profound impact on our consciousness. They literally put the brain to sleep, allowing doctors to perform surgeries without the patient feeling any pain. Though they work wonders, inhaled anesthetics do come with their share of side effects. But that's a topic for our next discussion. Until then, keep exploring, keep learning. Like all medical interventions, inhaled anesthetics are not without risks. It's important to remember that while these drugs are incredibly useful in facilitating surgeries and other procedures, they do come with a certain set of side effects and potential risks. Common side effects can include nausea and vomiting, dry mouth, and a sore throat. These are generally mild and tend to dissipate as the anesthetic wears off. However, there are also more serious side effects to consider. One such example is malignant hyperthermia, a potentially life-threatening reaction that can occur in response to some anesthetics. This condition leads to a rapid increase in body temperature and severe muscle contractions. Other serious risks include post-operative cognitive dysfunction, where patients may experience confusion and memory loss after surgery. This is more common in older adults and those with pre-existing cognitive impairments, but can occur in any patient. There is also the risk of aspiration, where stomach contents can be inhaled into the lungs, leading to complications such as pneumonia. Inhaled anesthetics can also interact with other medications, potentially leading to adverse effects. It's crucial that healthcare providers are aware of all medications a patient is taking before administering an anesthetic. And of course, there's always the risk of an allergic reaction. While rare, these reactions can be severe and require immediate medical attention. Symptoms can range from skin rashes and itching to difficulty breathing. It's also worth noting that the risks associated with inhaled anesthetics can be influenced by a variety of factors. These include the patient's overall health, the type of surgery being performed, and the specific anesthetic used. This is why it's so crucial for healthcare providers to conduct a thorough preoperative assessment to ensure the safest possible use of these drugs. Despite these risks, inhaled anesthetics remain an irreplaceable tool in the medical field. Their ability to induce a state of controlled unconsciousness, combined with their relatively quick onset and recovery times, make them invaluable in ensuring patient comfort and safety during surgical procedures. The potential side effects and risks are a reminder of the importance of careful administration and vigilant patient monitoring. Inhaled anesthetics, a cornerstone in the edifice of modern medicine. In our journey through the realms of pharmacology, we've enlightened ourselves with the basics of anesthesia, explored various types of inhaled anesthetics, and delved into their mechanisms of action and potential side effects. Now, let's shift our focus to the critical role these remarkable substances play in contemporary medical practice. Inhaled anesthetics have revolutionized the field of surgery, rendering procedures that were once unbearable, now comfortably achievable. Imagine a world without the ability to control pain during invasive procedures. It would be a world where the simplest of surgeries could become a nightmare. Thankfully, the advent of inhaled anesthetics has made this a distant memory. Not only do these substances allow for painless surgeries, but they also play a pivotal role in managing critical care patients. In cases of severe trauma or life-threatening conditions, inhaled anesthetics can provide the necessary sedation to stabilize patients and enable life-saving interventions. In recent times, the science behind these anesthetics has advanced dramatically. We've moved from the rudimentary ether and chloroform to more sophisticated substances like sevoflurane and desflurane. These newer generation anesthetics provide a faster onset of action, better control of depth of anesthesia, and quicker recovery times. Furthermore, research is continuously pushing the boundaries of what we know about these compounds. Scientists are exploring their potential neuroprotective effects and their use in treating conditions like post-traumatic stress disorder and severe depression. Inhaled anesthetics have also proven useful in pediatric medicine. Children who often have a fear of needles can be more easily managed using these substances, making medical procedures less traumatic and more tolerable for our youngest patients. In summary, inhaled anesthetics have become an essential tool in the arsenal of modern medicine. They have transformed the landscape of medical practice, enabling us to perform procedures with precision, comfort, and safety. As we continue to unravel the mysteries of these extraordinary compounds and discover new applications for them, their role in healthcare is set to expand even further. As we move forward, the role of inhaled anesthetics only seems to grow. Inhaled anesthetics, more than just a whiff of magic. We've journeyed together through the fascinating world of inhaled anesthetics, uncovering their origins, their types, how they work, their side effects, and their indispensable role in modern medicine. It's been quite a trip, hasn't it? Let's take a moment to recap the key points we've covered. We started off by understanding the basic concept of anesthesia, a medical miracle that has revolutionized surgeries and procedures, turning what once was a terrifying experience into a painless and comfortable one. Then we dove into the realm of inhaled anesthetics, a specific category of anesthesia that is administered via inhalation. We discovered the various types of inhaled anesthetics, each with its unique properties, from the volatile liquids such as isoflurane, desflurane, and sevoflurane, to the gases like nitrous oxide and xenon. We explored the mechanism of action of these anesthetics, how they interact with our body's proteins and membranes to produce anesthetic effects. This mechanism, while complex, is a testament to the sophistication of medical science and our understanding of the human body. Of course, like every medical intervention, inhaled anesthetics come with their share of side effects and risks. We discussed these potential issues, ranging from nausea and vomiting to more severe complications, like malignant hyperthermia. Being aware of these risks is crucial for healthcare professionals to ensure safe and effective patient care. Finally, we underscored the importance of inhaled anesthetics in modern medicine. They have been instrumental in facilitating a wide range of medical procedures, from routine dental work to major surgeries, making them an essential tool in the arsenal of anesthesiologists worldwide. In conclusion, inhaled anesthetics, while seemingly simple, are a product of centuries of scientific discovery and refinement. They embody the relentless pursuit of medical science to alleviate human suffering and improve the quality of life. So, as we end our journey, let's appreciate the intricate science behind these marvels of medicine. Remember, the magic of anesthesia is not just in the sleep it induces, but in the pain it eliminates.